this is heavily about how leaders handle these situations. And what we don't see are consistent leadership, certainly from the president, around turning the temperature down. We cannot allow the violence and cannot stoke it further. And so we need more of those voices on both sides. But at this moment, with the president being a Republican president, we need Republicans who are stepping up. So it's not just one party versus another.
Hey everyone, welcome back to The Tent, your place for politics, policy, and progress. I'm your host, Colin Seeberger. That was Atul Gawande, a surgeon, author, and public health leader. In the wake of Charlie Kirk's assassination last Wednesday, there's been a lot of discussion about the state of gun violence in this country and the role mental health and partisan rhetoric plays in it. Dr. Gawande and I broke down some of the root causes of violence in this country, as well as the state of public health in America today. From tumult at the CDC and attacks on vaccine access, to how the administration's policies are increasing cancer-causing pollution and endangering children's health, we covered it all. And stick around after the interview for a moment of joy, because it was a wild weekend of NFL football, and we've got to talk about that Cowboys-Giants overtime nail-biter. Atul Gawande is a surgeon, author, and public health leader. He was assistant administrator for global health at USAID, and before that, a longtime professor at Harvard Medical School and Chan School of Public Health. He is also a longtime writer for The New Yorker magazine and has written 4 New York Times bestselling books. Dr. Gawande, welcome to the pod.
It's great to be here.
So I'm talking to you this week, the week after what was obviously just a terribly tragic assassination of a far-right influential podcast host, Charlie Kirk. This, was an episode that really grabbed the public's attention, I think, in response to what we have seen as a real increase of political violence in this country. And yet at the same time, we've seen other tragic deaths occur in recent days, or threats of violence, whether that be Colorado Elementary School last week. The DNC actually received a bomb threat the day after the Kirk assassination. And a number of historically black colleges and universities ended up having to go into lockdown after threats of violence. Drawing on your experiences as a doctor and a surgeon, I'm curious to get your perspective on this rise of political violence. What do you think is motivating it? And, what can be done about it?
Well, first of all, the place my mind goes on this is I'm trained as a general surgeon, did trauma surgery, and my stomach fell when I heard the news of Charlie Kirk's killing. Mm-hmm. Because not only was it terrible that politically we're resorting again to violence, and there's been so much, just weeks before at the CDC, policeman David Rose was killed, and people had their windows shot out in the immunization division, right? So, and that people didn't seem to have any attention to that. My stomach fell though, because this is like gang violence that we're seeing. Violence begets violence, and you end up in this spiral. And the first thing I thought of is programs, often not very well funded by the federal government, I'll point out, but for hospital-based violence intervention prevention. These programs cut the likelihood of what's called re-injury, the likelihood that someone who's been shot or stabbed would end up in another violent situation after you've saved them. And it cuts it by half. And the critical elements of it are to understand revenge is common, and people around that person may create more violence. And so one of the things you say in this intervention is you make them know, we're glad those who did survive survived, and that isn't always what happens, as with Charlie Kirk. That violence is not our destiny. You let them know that you have the power to determine what's going to happen next. You don't have to let the pack decide. You don't have to let the street decide. And the number one thing you ask them for in terms of action is pause before you retaliate, and ask people around you to pause before they retaliate. Don't make any moves right now. It lets the temperature come down, lets us be thoughtful about what we're doing. The more time can pass, the more likely we're able to contain the violence. And so, I'm grateful that in the first few days it hasn't immediately begotten violence, but we still have a ways to go.
Certainly do. And of course, Charlie Kirk's assassination was not the only attempted or successful assassination that we've seen this year. And you brought up the shooting at the CDC. I think there's often a lot of time, kind of an instinctive gut reaction from some to solely blame these incidents on a rise of a mental health crisis in this country, which is certainly true. And yet at the same time, many of those who are quick to blame a mental health crisis are simultaneously gutting Medicaid, which happens to be the largest provider of mental health largest payer, of mental health services in this country. Yet it's not lost on me that Melissa Hortman was shot and killed with a gun. Charlie Kirk was shot and killed with a gun. What do you see as kind of the influence of the pervasiveness of guns in our culture, and what interaction that is having with this rising tide of political violence, and what we know is too many people losing their lives too early?
Yeah, we're awash in guns, and they're a setup for violence. Homes with guns are much more likely to have them, to use them in suicide by far than in protection. But we've been awash in guns for quite a while. And I think there are important things to be done to improve gun safety that we could talk about. I think there's a lot of different factors that go into violence begets violence here. One is that we're at a moment where, yes, there can be mental health issues. I don't know that the person who killed Charlie Kirk had a mental health issue, or the state representatives in Minnesota, or the shooter at the CDC who killed the policeman and shot at others. That can be a factor, and having a gun at the ready is a consideration. But what you also see is that they're part of communities often that are inspiring violence. One colleague at PBS Frontline, a team had done a show called Terragram, and this was a documentary just recently out that talked about the online 4chan world, where people are being developed and stoked to provoke violence. And in this case, it was about nationalist groups who were often right-leaning, but there are versions that are left-leaning as well. And you could see in the person accused of the Charlie Kirk killing that they were very much in that kind of community and society. We have work to do. We're in a technology space where technology has isolated us more and more, has drawn people into different circles of hell, and communities where we are disconnected from one another. The most important thing that we do is create connection across lines, and the ways that our communities are dismembered, disconnected, and people feel isolated where they live, that is, I think, a vital driving force, a dangerous driving force.
That's certainly true. And at the same time, even as we have these algorithms that are driving people further into isolation, we also are seeing that happen against a backdrop of increasing demonization of people who have different beliefs, right? And we saw that, in the immediate aftermath of the assassination of Charlie Kirk. We have seen that from, frankly, some leaders in government right now of public health professionals who, may be offering guidance that, does not subscribe to the same ideological perspectives as, leaders of the MAHA movement, so to speak. So I'm curious, because we have seen some of these things play out in really tragic ways, like the shooting at the CDC, how has this sort of demonization really impacted the scientific community?
Yeah, I remember writing for The New Yorker during the COVID pandemic about the number of public health officials across the country who've been threatened, and the ones who are most immediately targeted are often local public health officials and county public health officials who at that time were, asking people to wear masks or pushing vaccinations forward. Let's remember, 95% of people over 65 got the vaccinations and had a dramatic change in what our life in our community could be as a result of the vaccination. So let's put that aside for the moment. But it was a shock that basic public health guidance could be could lead to demonization, to the point that in many states, Kansas, for example, you had so many resignations, you had difficulty filling public health positions in communities for a while. So we've been stewing in that. I'd say the second thing I would want to add is, at moments in our history where the hard issues are being raised, whether it was civil rights in the 1960s and the early 1970s with fair housing, whether it was or whether it's, our battle over many, many issues today where the country is deeply divided, confronting the issues, actually needing to work through them, has required leaders who have a choice. They either create a holding space for people to engage with one another peacefully, or we turn up the temperature on the burner so hot that the aim is to try to extinguish one side or the other. And this is heavily about how leaders handle these situations. And what we don't see is consistent leadership, certainly from the president, around turning the temperature down. I was so relieved and thought it was so important to hear the governor of Utah come forward with not only a message for the moment, but a man who's been consistently pushing the idea that we have to handle these issues with peace, with civility. There's going to be heat, there's going to be anger, but that we cannot allow the violence and cannot stoke it further. And so we need more of those voices on both sides. But at this moment, with the president being a Republican president, we need Republicans who are stepping up. So it's not just one party versus another. And I do think Democrats have been speaking out about those who are cheering on violence on the left. It is crucial that we also speak to those who are want to threaten to bring violence to our political opponents.
Absolutely. Just to kind of change gears here, obviously that was a really heavy topic that we wanted to break down with you. I'm also curious to get your perspective on, I brought up the MAHA movement. RFK Jr., the administration, has been furiously at work over the course of the last 9 months or so since taking office in January. We have seen, then Secretary-designate RFK Jr., really kind of presented himself to the public by saying, I just want more facts. I just want more science. I want more information in order to be able to understand what's driving chronic disease. And since then, since he's taken office, there have been a number of reports. Dylan Scott at Vox recently published a story on how the administration has actually been, suppressing studies that link alcohol to, as a cancer-causing agent. A number of different studies we've seen at the same time the administration is stripping funding from state and local health departments. None of that seems to be about fact-finding, about finding answers, and it certainly doesn't seem to be working toward making people healthier. Am I missing something here?
No. There's so many perspectives to bring on this. Let's start with what is MAHA. There are elements of making America healthier again that are completely sound. We absolutely have too much ultra-processed food. We absolutely need to be addressing the big killers, but it's so selective. If you ask what are the big killers in our environment and in our communities, number one far and away is tobacco, barely mentioned in the MAHA report. Number two is air pollution. Small particle air pollution and indoor air pollution are major killers in the world and continue to make a difference, especially in certain occupations in the United States. Number three, added sugar. And the effort to address not only adding sugar, but the ways we eat ultra-processed foods. Just sugar alone, as an addition, the average American has 60 pounds of added sugar per year. And that is an accurate statement from the MAHA report that was put out earlier this year. But then the second MAHA report about what action is going to be taken ended up saying use the word sugar once, offered no actual actions on these things that mobilized a lot of followers of the MAHA movement, and instead has gone full tilt against vaccines, one of the most life-saving tools of the last century. In the last 50 years, deaths in children have dropped 75%, and 40% of that is from vaccines alone. We're now in the process, RFK Jr. is in the process of dismantling our childhood vaccine and adult vaccine system. And it's not just that RFK Jr. is doing this, it's that the president is allowing this to happen. This is the same administration that dismantled USAID, the Agency for International Development that over the last 20 years, in an independent analysis, saved 92 million lives by bringing globally programs that have controlled HIV, reduced TB, reduced child deaths in the world, and made America safer from outbreaks all around the world, the place where I led global health for the last 3 years. And then I returned to Harvard, where a $3 billion world-leading program in health and science discovery has been shut down. And there's a war on research to the point that it's not, HIV vaccine research has been stopped in the country. The science of treating cancers has been set back years. We've shut off programs for some of our most talented scientists in the world, and for the next generation of science to come. So all of this is an indication that it's a whole administration that has not only offered no commitment to sustaining science, but has actually gone on the attack against basic infrastructure in healthcare and in public health that has made the U.S. the superpower of science and health in the world, and helped us lead giving human beings 3 extra decades of life. Why are we trying to take that away?
It doesn't make any sense to me. I mean, it does seem to me that I think you pinpointed something, and that is, a lot of the kind of concerns voiced by MAHA leaders, right? They seem to be diagnosing problems really well. It seems to be the prescriptions that are being put forward by this administration not only don't solve the problems that MAHA is rightly calling out, but that they actually, stand to aggravate or augment those challenges by creating a whole bunch of new unnecessary ones. You mentioned kind of dismantling of vaccine programs. We have seen recently the Surgeon General of Florida basically said that they're getting rid of the school vaccine requirements. And simultaneously, we've seen Secretary Kennedy install ideologues on vaccine review panels. What should the American people expect are going to be the outcomes of these policies? When should they expect to be seeing the outcomes of these policies? And what is it going to take to undo the damage?
Yeah, the infrastructure from discovering new vaccines, the manufacturing of vaccines, the approval in the FDA, the CDC guidance on how to use them safely and effectively, and then the distribution through everything from insurance programs to sending them around the world. Bit by bit, all of it's being chipped away, and it's happened at a rapid pace to the point where we can't have confidence, and I'm talking about doctors, no longer have confidence that they can rely on FDA and CDC guidance, which is where we turn to for our practice and for our approach to taking care of people. We are now turning to rely on our professional societies, whether it's the American Academy of Pediatrics, American College of Surgeons, in my case, and others. And we see states starting to need to go their own ways with Massachusetts and California, among others, starting to create their own schedules and try to protect insurance coverage for people around vaccines. I think we already see action happening where insurers are no longer covering COVID vaccines for a large majority of the population in some states. And some of the actions that states are trying to take aren't going to be sufficient to address that. More importantly, at the time we're doing this podcast, in the next couple of days, there's an advisory council meeting of the CDC on other key elements of the vaccine protocol, the vaccine arsenal that we have, putting into question, for example, hepatitis B vaccines and whether they'll still be provided at birth to children. This is a vaccine that where 20,000 children were born per year with hepatitis B before the vaccine came into place. That's less than 20 today. Hepatitis B is a killer for children. 90% of children will go on to get chronic infection with the disease. And we've solved this. We've solved this, and we're at risk of taking that away in the next few days, if not, or else weeks. So we're in a long slog to restore and save what we can of our vaccine preeminence in the United States.
I'm curious too. You formerly served in government. You know a lot of people who continue to serve in government. We have seen in recent weeks Secretary Kennedy dismissing the former CDC chief, Susan Manaras. I know she's going to be headed up to Capitol Hill this week to testify. What are you hearing from your former colleagues in government who are there trying to serve the public? What are they describing as happening kind of behind closed doors? If you can lift the veil for us and give us a picture of just how this administration is approaching government. I think that would be really illuminating to our visitors.
Well, I feel like it's a replication of what I saw happening at USAID when USAID was ultimately dismantled. It started with staff being purged, small numbers and then larger numbers, then funding being cut off, and then ultimately the dismantling of major parts of the institution, and then finally the whole thing. I don't know if it'll go completely that far with CDC, but it's already happening. Programs, top leadership of everything from HIV prevention to immunization. You've seen purges happening. They are no longer being able to put out authoritative information consistently. So, for example, the normal process of an advisory commission on how to manage vaccines, on how, for guidelines on vaccines, would have CDC opinions put out publicly and shared and included as part of the program. Instead, for example, on measles vaccines, the authoritative delineation of what research has shown was taken down and blocked by Secretary Kennedy, and then he put up his own assessment, unclear where it came from, full of inconsistencies, had clearly manufactured information and footnotes that were generated by a chatbot and were false and not connected to any real document, being used to make decisions on what vaccines Americans are going to have and who will get them. That is the state we're in. And what the colleagues are telling me is that they're in the dark. They're not being consulted. They're not being asked to assess or provide recommendations. It's why a large part of the leadership at CDC resigned. To the extent they're being asked to do anything, it has been being asked to do things that violate scientific integrity, and ultimately they couldn't do it and they resigned. We've seen that now in multiple agencies. It's just another one that's coming under the thumb.
So you mentioned, researchers, doctors being, having their backs pushed against the wall and having to violate scientific integrity. At the same time, we see, you mentioned the administration just freezing or cutting off, important public funding for medical research to find cures to what could be deadly diseases like cancer or Alzheimer's. What do you worry is the kind of collective outcome here of this sort of antagonistic approach to science and American innovation? Do you worry that we are going to see kind of more of our scientific leadership end up just saying, I'm going to go help people somewhere that, a country that wants me to help them, help the public?
The consequences are enormous for us economically, in terms of health, and in terms of talent. We are the country that for the last 80 years has led the world in discovering the solutions, then moving them out into the country and into the world, that added that virtually doubled our lifespan. We went in the 1900s from a 47-year average life expectancy in America to a almost 80-year life expectancy. We have the discoveries that on average, if you can get the health care we have and the public health benefits that we have, the average person in the country who has those resources lives 90 years on average. It is an extraordinary transformation of human life that America led the way on. There is no loss of trust or belief in the scientific enterprise, in research, in our community doctors and nurses and the people who do the work. There's lots that's creaky and broken about the systems. I've spent my life both researching and writing about ways we could be doing far better. But the effort to insert chaos, destruction, and denial of reality into this process is regarded widely with horror in the United States. 90% of Americans still, in the latest poll, support the belief that childhood vaccinations save lives and are effective. 80% believe they should continue to be required in schools for children to safeguard the country as a whole. Those numbers, by and large, haven't changed. The 20% who don't have confidence, however, are ones that really matter when you need to get to 90% vaccination. Furthermore, we haven't ever been in a position where the leadership of the country is made up of people who are anti-science, who are against our scientific and medical capabilities that we have in this kind of directed way. And that's where distrust becomes dangerous. When you have leadership that is actively trying to foment uncertainty, doubt in things that work, that is an unprecedented situation for us. I've seen it when I was leading USAID in places like South Africa, where the president denied HIV was happening, in Tanzania, where the president denied that COVID was killing people or that the vaccines would make a difference. That president died of COVID, and South Africa became one of the most devastated countries in the world from HIV as a consequence. This is not the future we want for us.
Yeah. You talked about some, public leaders trying to mislead the public intentionally. I am curious for your perspective on, given the fact that we have seen a decent amount of erosion in public trust for some public health experts over the course of the last few years, what should leaders in this field be doing to regain the public trust in this difficult environment where there is a lot of intentional misleading going on? And, those who are doing this successfully, what are they doing?
One of the things that I've always cringed at is when people say trust the science.
Yeah.
And I cringe at it because science gives you the facts, but it doesn't tell you what to do with them. My last book, Being Mortal, was about saying people have priorities in their lives besides just living longer, and medicine can get to the point of saying, being so focused on your disease that it misses the human being. And the lessons that came out of that, of interviews with lots of people towards the end of life and clinicians who are great at taking care of them, was that people have priorities in their life besides living longer. We need to ask what those are, and then we need to tune our treatments around them. Well, in public health, it amounts to the same thing. In the 1980s, we lowered the speed limit to 55 miles an hour, and the country rebelled against it. And people in public health would say, well, but there's going to be 5,000 more lives lost if you raise the speed limit to 65. And we just said, you know what? It's too damn slow. We're going to raise the speed limit to 65. And then we got to work with anti-lock brakes and lots of other things that actually kept those lives from being lost. Well, in a similar way, when COVID happened, the science was clear about the value of masks, for example. It kept people from spreading the disease in hospitals in a way that, it ran like wildfire through Italy and Spain. Understanding that the vaccine and distributing it saved lives was critical, but the shutting down of schools was devastating, and we're still paying the costs in mental health for folks. And recognizing that the science wasn't going to give you all the answers on these things, but that we could put the facts out as they were, have political figures make the trade-offs, have disagreements about where those trade-offs could be, but that's the natural way it goes. I think we have to be attentive to that more in public health. It's a major lesson that we took out of the COVID pandemic. But what we're arguing about right now are huge killers. Measles vaccines. I mean, measles still kills over 100,000 children a year around the world. And we have, whether it's measles, mumps, rubella, polio, there are what we're up against here is a situation where we're dealing with disinformation and people who are taking advantage of the uncertainty and the chaos and the sense of anger and sadness about what had happened after COVID.
Now, on a different topic here, you've probably seen the headlines in recent weeks that the United States is staring down just a huge increase in the cost of health coverage for next year. Many insurers and others have been saying this is, in part driven by the president's tariffs, which are increasing the cost of medical supplies, pharmaceuticals. Of course, there were also changes that Congress made to health coverage in the Big Beautiful Bill that they passed this summer. At the same time, we know that the enhanced financial assistance available to people to buy health insurance that the Biden administration passed is set to expire at the end of this year. Congress has thus far voted against extending those enhanced premium tax credits. And now you see Democrats in Congress are saying we can't support a government funding deal that puts millions of people in this country of facing exorbitant healthcare costs or losing their coverage altogether. If we don't tackle this problem. And thus far, it seems that Republicans in Congress are unwilling to address this and before the government may shut down. Why is it important that this enhanced financial assistance get extended? And, what do you see as the consequences if this doesn't happen?
Well, what the biggest cost rise has been in the costs that people face for their out-of-pocket expenses for healthcare. As we dial back on the progress we'd made on people having insurance under the Affordable Care Act, which got people healthcare.gov coverage or coverage through Medicaid. That is the biggest damage will come. We finally have progress, for example, against opioid addiction, where the numbers are going down. That's predominantly people who've been getting treatment on Medicaid. And the cutbacks are going to deeply affect many that have been many of the population that has been addicted. HIV prevention programs are being dialed back, and those are heavily people who've been covered, are young people and people who are low income, covered by either Medicaid or Obamacare. So these are devastating for the health of the country in lots of ways. Then you have the effects of the tariffs on pharmaceuticals. We went for having the cheapest possible drugs in the world and without diversifying the supply chain so that a large amount of the raw drug substance is manufactured out of China. And at a moment that you are piling up the tariffs on China, on India is the second big source of pharmaceutical substance in the world, without having generated and manufactured diverse sources for these for our life-saving drugs, we're going to have shortages, as well as we're seeing high tariffs starting to have those effects on the drug costs. And then you have inflation in the economy as a whole, and that raises the costs of labor, and most of healthcare is the cost of the people. And so health is going to be deeply affected by what's happening in the economy, and that's playing out in multiple ways. We have a further thing, which is we spend a lot of money on healthcare and don't get enough out of it. I'm a huge proponent of primary care, and we have only been shrinking how much we support our primary care workforce. We don't pay them enough, and we don't value them enough to make sure that we are helping them be functional, so that becomes the real place that people choose as the first place to go for their health care, not emergency rooms, not high-end specialists as the first thing that we do. So there's many dimensions to this problem, but I do think they're all solvable. We've made a lot of progress in the last 10 years flattening the cost curve, and we are seeing the risk of it spiking again.
Also made a lot of progress in making sure that people have health coverage. A record number of people going into this year had health insurance, and now, like you say, could be turning back the clock here. Dr. Gawande, this has obviously been a heavy conversation. We've talked a lot about things that may be holding the country back. But I'm curious if you could reflect on what is, in this moment that is difficult, bringing you hope in your work, and how Americans may look to something to inspire them that there are better days ahead.
Well, it's almost, my inspiration comes from a sense that over and over again, values matter, and it doesn't feel like they do at the moment. But I go back to something, this is going to sound very woolly, but Tacitus warned the Roman emperors that rule by force and empty of ideals is hated, unstable, and short-lived. And it's been demonstrated in history over and over again. I can't say how that works on the political cycle, whether it's a year from now that reality hits, and or it's the next presidential election, or it's 10 years from now. Many of the problems we're working through are really fundamental and go well beyond Donald Trump. I mean, we are in a economy now that rewards knowledge. It rewards the knowledge worker. Maybe even they are being replaced by AI. But if you don't have a college degree, your ability to own a home, have a secure enough income to start a family, have a couple of kids, that has been gone for 20, 25 years. And neither party has been able to garner enough support to actually address it. And we're paying the price of too many people not having enough stake in the way our best institutions work, our systems can be relied on. And I have faith that over time we will persevere because we're actually needing to face these facts and grapple with solving these problems.
Dr. Atul Gawande, thanks so much for joining us on The Tent.
Thank you.
All right, folks, that's going to do it for us. Please go back and check out previous episodes here with us to break down some of the major events over the course of the past week is our supervising producer, once again, Kelly McCoy.
Sports.
Yes, sports.
We love them.
We do. And there was one heck of a football game that took place on Sunday afternoon. While I love chatting with you, I do wish Daniela Gibbs-Leger, our former lovely co-host, was here because her New York Giants took on my Dallas Cowboys in what was one of the most ridiculous and pathetic football games I have seen in a long time. The fourth quarter, the Cowboys ended up taking the lead with 2 minutes left to go. That was then followed by the Giants scoring a touchdown in a matter of seconds and taking the lead by 3. And then the Cowboys coming back to tie the game with 3 seconds left to go with a 64-yard field goal. I think it was 64. Maybe it was 60. Regardless, It was nuts. Mm-hmm. And then overtime starts, and neither team can get the job done. Yeah. And it, wound down to the last couple of minutes of overtime, and it was looking like we were going to end up both teams having a tie, which is, of course, the right ultimate result for these two teams because neither one of them
deserved the W.
Yeah. But the Cowboys did pull off the win.
You're pleased to report.
Yes.
Yeah, I didn't watch the game, but I did see the scores going back and forth, and I was thinking of you two the whole time, and I was pleased to learn on Monday that you were texting about it.
Yes, there may have been a little trash talk going on.
And wishing I was in that text chain. And I also appreciate that while Daniela may have technically left this organization, she is with us in spirit every week, seemingly, as we continue to break down football, which is, I think, appropriate.
She certainly is. And just for our longtime tent listeners, you will know that Daniela and I are longtime Bachelor and Bachelorette viewers. Mm-hmm. You may have seen recently that The Bachelorette announced that Taylor Frankie Paul, the star of The Secret Lives of Mormon Wives, mm-hmm. Is going to be the new Bachelorette. It is quite a decision from the producers. Intent listeners know that we will be covering this in the crucial months ahead because, I mean, it's only looking up for Taylor Frankie Paul after her
truly remarkable follow-up.
Yes.
You know it's a big deal if it's like broken through into my social media channels, and I don't know that we'll ever get all of the tea about what they were swinging, right? That was the deal with this. Of course. Anyway, there's a lot going on seemingly in Salt Lake City. So I hope we get the tea.
Yeah.
What I have been watching as of late, bringing us back to Sportsland. So it is WNBA playoff season.
That's right.
I have been looking forward to this for a very long time. Really phenomenal basketball happening, great fashion. The looks are top notch. Lots
from
of
the players or
players, spectators. I will note that New York Liberty, their mascot, her name is Big Ellie, and I cannot get enough of her. She sat, I think, front row at New York Fashion Week, and if you haven't seen clips, you should go watch her. She puts on a stellar halftime performance. So in case you need to mix up and do a little palate cleanse from football, as of this recording, starting up the second batch of games tonight and tomorrow. So gotta go watch.
We'll tune in.
Yeah.
Okay. Well, folks, you have your entertainment recommendations from your lovely tent team. I know tomorrow night I am going to be watching. It is the series finale of The Summer I Turned Pretty, and we have so much to resolve. So I will be settling in, may have to even pop some popcorn or something.
Do you want to give any belly predictions? That name is just...
Kelly, don't besmirch.
I'm sorry.
Isabel. But she had better end up with Conrad.
Team Conrad.
It is going to be... You are not going to hear the end of it from me next week, pod listeners. So you have been forewarned. We will have so much to break down.
And... did I hear right that Taylor Swift has a song on the finale?
Well, we'll see.
Okay.
We will see.
I'll be tuning in.
Yes. And with that, we'll talk to you next week. The Tent is a podcast from the Center for American Progress Action Fund. It's hosted by me, Colin Seeberger. Muggs Leone is our digital producer. Kelly McCoy is our supervising producer. Mishka Espy is our booking producer. Haifan, Olivia Mowry, and Tony Pandolfo are our video team. You can find us on YouTube, Apple, Spotify, Google Play, or wherever you get your podcasts.